Good morning, audiences. Today we are here with Dr. Siddharth Aiyer, spine consultant in Sancheti. Today we will be having a small talk over the common spine problems occur in children. So,
Hi, sir. Yeah, go ahead.
Good morning, sir. So, what are the common ailments of spine problem seen in children?
Okay, so normally we don't get that many spinal problems amongst children. More often than not, back problem and neck problem. This is a problem that is seen in elders. But there are some spinal conditions such as scoliosis, which are common in the pediatric age group or that present in children. Some other infections such as TB spine, which is in India quite common, also can affect children. But largely most of the pediatric patients that come to us in the spine OPD are coming to us for cosmetic reasons because they have something like a scoliosis, which is crookedness of the spine, or they may be kyphosis, which is like a hump forming over the spine.
So, speaking about scoliosis, what is the cause of scoliosis?
Okay, so scoliosis in children can be due to multiple reasons. Depending on the age that they develop the scoliotic deformity, you can have problems such as congenital scoliosis. So basically it is a dysfunction or a problem that is seen since birth. And because the formation of the vertebral body elements at birth is improper, they tend to develop scoliosis, which is called congenital scoliosis. Some other types of scoliosis, such as adolescent idiopathic scoliosis, there is no one reason to it. It is supposed to be multifactorial, with both genetics also playing a role. Those scoliosis may be seen more in the teenage group of patients, so anywhere from say the 10th year onwards to up to maybe 15 to 16 years. And adolescent idiopathic scoliosis is quite common, more commoner in girl children rather than boys. So depending on age, there can be congenital scoliosis, there can be idiopathic scoliosis, there can be neuromuscular scoliosis. Some other problems such as neurofibromatosis, Marfan syndrome, these are also complex collagen vascular disorders, and they can also develop scoliosis.
Okay. So, sir, how do we treat scoliosis?
Okay, so treatment of scoliosis again depends on what age group the patient has presented to us, what is the severity of deformity. Generally in children who are young age, so less than 10 or 11 years, and who have smaller curves, who are not very large scoliotic curves, and they may be patients who are observed on serial x-rays, so every 6 monthly we would see x-ray and progress it. Sometimes we would offer a belt or a brace, something like a body mold which they can wear to prevent progression of the scoliosis. But in some cases where the curves are already very large and the patients have reached the hospital facility very late in the disease, and already a significant amount of curve has developed where it's maybe 50 degrees or 60 or 70 degrees, and in those cases sometimes even surgery is sometimes required. Okay. So this was in short a few things that we see in the OPD as far as pediatric problems, especially in the age group that is less than 18 years of age.